Hi, good morning, and welcome to Sharon's Home Care Solutions. I wanted to continue our discussion today about infection control related to COVID-19 specifically. And I wanted to bring some more research-driven information to you and just continue to support hand washing, hand hygiene, just in our everyday lives, but specifically to nurses and to the healthcare professionals. So to get started, I just wanted to say thank you for joining us. If you have not seen the Infection Control Common Sense 1, please do so before you go any further, because it will just kind of tie things together. But I wanted to say a couple things, bring a couple things to light here. There was a journal, the Journal of Pediatrics and Child Health, from June this past year, 2020, reports this. And I'm quoting specifically. During the 2009 pandemic of H1N1 influenza, which is the swine flu, encouraging the public to wash their hands reduced the incidence of infection significantly, whereas wearing face masks did not. There is no good evidence that face masks protect the public against infection with respiratory viruses, including COVID-19. And that is from the Journal of Pediatrics and Child Health, June issue. And I wanted to say just something about that. Yesterday, I was taking advantage of curbside service at a store. And when I got there, it wasn't exactly curbside. I had to go to the back of the store and then enter the store and go to a desk to give them my receipt. And when I did that, there was a sign at the counter that said face masks were required to show humility and to show kindness to others. And that kind of grabbed me wrong, because it should have been about infection control if indeed this issue about wearing face masks is about infection control. And I'm kind of perplexed and confused. I'm not sure it is anymore. This week, also on Monday, I received an email in my Gmail account that said patriots wear face masks. And I'm like, okay, well, insult upon injury here, because I'm a patriot. I love my country. I support my country. I have served my country my whole life with serving my family and our communities. And I'm also kind, and I feel like I'm humble. I feel like God directs us to those roots of the spirit. So I'm a little bit perplexed. But to get back to the Journal of Pediatrics and Child Health, again, June 2020, it says that there's no good evidence that face masks protect the public against infection with respiratory viruses, including COVID-19. And I understand we need to continue to research, and we need to continue to delve into this issue so that we can protect each other from infectious organisms. But as a nurse in home health care for several years, and also on the mission field in Honduras, I only wore a face mask one time, and that was when I was treating a patient with respiratory MRSA. And it was to protect myself and my next patient who I was going to. However, as a nurse, being a proponent of infection control, I was always careful when I had to wear personal protective equipment, with MRSA especially, because now it is community acquired as well as hospital acquired, that I saved that patient for the last patient of the day, donned my PPE at the patient's house, which included a face mask because of respiratory MRSA. And before I left his house, I carefully took off my PPE, my mask, my gloves, and my gown and disposed of it in a closed bin right there at the patient's house, and immediately went home and took off my clothes, showered for the day, and went on with my daily life. So that's one time in my nursing career. Um, so do you see my confusion? We were test fitted every year at the hospital for an N95 mask. I always had it with me in my car and I never had to wear it. But so I'm a little bit confused as a nurse. Okay, so I'm still researching, I'm still looking for information that points to scientific information that points to the efficacy of wearing a mask. I know all about hand hygiene. I get it. I am a strong proponent of it. I teach my grandchildren. I teach our children at church. I speak about it. I talk about it. Yeah, infection control. It is vitally important when we're talking about infectious organisms. So here's just another bit of research that I came up with. Universal masking in hospitals in the COVID-19 era, and this is from the New England Journal of Medicine, May 21st, 2020. I quote, "We know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. Public health authorities define a significant exposure to COVID-19 as face-to-face contact within 6 feet with a patient with symptomatic COVID-19 that is sustained for at least a few minutes, and some say more than 10 minutes or even 30 minutes. The chance of catching COVID-19 from a passing interaction in a public space is therefore minimal. In many cases, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic." End quote. From the Universal Masking in Hospitals article in the New England Journal of Medicine, May 21st, 2020 of this year. Interesting. In many cases, it says, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic. The store that I was at yesterday, I decided to go on their website today and just report my interaction yesterday with the man at the desk where I had to take my receipt to pick up my curbside products that I had ordered and already paid for. And while I was in the store yesterday, he told me that I would have to wait outside for my pickup. And I said, that's fine. I chose a curbside pickup. And so I don't really know if I'm in the store anyway. So, I mean, I am not rebellious. I am happy to go outside. I was happy to purchase online and pick up at the curbside, but that wasn't the way that it came down. And so I went on the website today just to share some of my research with that customer service, whoever that poor person is that's getting my email today, about my experience yesterday, and also to share some of this information from the New England Journal of Medicine and also from the Journal of Pediatrics and Child Health. And so when I went on their website, I looked specifically for their infection control practices because I just want to make sure that I'm not making anything up. So I went on the website and it said that they require face masks, which now includes full face shields. Okay, well, I had heard a couple doctors at the national level also say that last week. Full face shields and face masks. And that's a store in our local area, several of them in our local area, that now requires, according to their website, not only the wearing of face masks, but full face shields. I thought that is so bizarre. Anyhow, I don't think we're talking about infection control anymore. I just have going to leave you with one more report by the National Academics of Sciences, Engineering, and Medicine in their April 8th, 2020 report that says, there is little evidence regarding the transmission of small aerosolized particulates of the size potentially exhaled by asymptomatic or pre-symptomatic individuals with COVID-19. That was the report by the National Academics of Sciences, Engineering, and Medicine, April 8th, 2020. I'm happy to pass on the references that I have. I can link them below. I'll have to figure out how to do that because I'm new to all this stuff. But if you want to contact me personally before I get them linked, before I figure it out, feel free to do so. I have the links where you can just link right on and read the information yourself. Otherwise, I'm still kind of raising my eyebrows and shrugging my shoulders, and I just don't know where all this is headed. But I do know, as a nurse, as a mom, as a grandma, infection control is vitally important to me. So stay safe, keep your hands washed, keep your homes clean, your children protected, and let's just think about common sense infection control practices. Thanks for joining me today. Have a blessed day. Bye-bye.